All right, you are all set.
Okay, so the meeting's coming to order. Do we need to do introductions? I don't think we have anyone who's new or doesn't know anyone here. So I think we can skip that today. Any additions or deletions to the agenda? No? Okay, how about the approval of the minutes? Do I have a motion for that?
We have enough for them.
We do.
I thought, did you
Because
say we
have
did?
six in the room. And Larry. 7 or 1 short. We can come back.
One short, you said?
Yeah, because I don't know the status of Stu and Dr. Zepp.
Okay. So scratch that and we will move on to privilege of the floor. Any questions or comments? Sure.
So it's, we have official notice that as Tompkins County's Collaborative Solutions Network, which is our county's system of care, which is Sally Manning and SPOA and anyone in the county who's interested in collaborating around children's mental health, has been in conjunction with Full Zulu and the Human Services Coalition has been awarded an OMH grant of $10,000 to be putting on focus groups this summer for trying to get youth and family voice on mental health supports and ways that we can continue to incorporate their voice in a way that fits the community a bit better. So we're going to be putting on a series of 10 focus groups, 5 geared toward youth and getting their voice directly, and 10 of which are geared toward caregivers. We'll be able to compensate participants with a $30 MasterCard, like general gift card, for participating in the hour-long focus group. If people have thoughts, ideas about ways to, we're trying to think about how to reach especially the most underserved and rural pockets of our county. But if people have any thoughts about different formats or locations or questions or any ideas, feel free to reach out to me. I'm doing a lot of the coordinating of it, although the overall effort is being taken on by the Collaborative Solutions Network's prevention task force that I facilitate with other cool folks in the county.
Do you have the plan in place about how you will do it? Like, would you go to like different communities and?
I have a draft plan that is largely in my head at this point.
Yeah, I just meant like, are you gonna go to Dryden? Are you gonna go to Enfield?
Yeah, so we're looking at different locations, such as doing like the Newfield Library, Enfield Community Center, various other libraries, trying to get somewhere downtown, talking about we can also do one or some of them online, make that available to people as well. So nothing is set in stone, but we're looking at a variety of different locations to try and grab folks who are at BOCES doing summer programming and people who are at like summer camps, those kinds of things too.
Sounds good.
Yeah. We'll keep you guys updated, but that is coming this summer. And likely we'll put out advertisements to our listserv here for you all to share with your communities as well.
Great.
Yeah,
Thanks
I'd
for
be
that.
interested in what you're doing and how I can help. I actually met with counselors and therapists and the administrator and guidance counselor of Newfield 2 weeks ago. And they gave me a run through what they've been going through and services that they have and ones that they don't have anymore. And their overview of children's mental health. And they did a lot of work, so I'm glad to share those things. They did a bunch of notes and those things and they're working with the health department. There is a lady that comes there a couple of days a week. They need help. So I really like the idea of listening to the kids somehow to get their input on
Yeah.
Listening to the kids and compensating them for their time, I think that that becomes a large barrier to us getting a lot more of that family and community voice is, that childcare isn't free and, getting off of work to like come to these meetings isn't free. And so being able to compensate people for their time to share their
Keep
lived
in mind that
experience.
one of your biggest barriers, as soon as you get into the rural communities, transportation.
And that's why we're gonna try and go to where people are. But yes, I know, and that's what the online options will be able to, of course, that still requires people to have solid internet connection. I know.
Is Cornell Crop Extension involved? Anybody from that group they're doing family and children, they're doing counseling now and with especially people for incarcerated people, they're doing family counseling for that. And they're doing they have a couple social workers and they just did a whole study on transportation needs assessment, which focused a lot and there was a good response in how marginalized people in the poor population are struggling the most to access to anything, right? So it's a good study. It was paid for by New York State and Park Foundation and numerous other people.
Do you know what sub entities within Cornell Cooperative Extension are doing?
I do. I can get that to you.
Okay, I'll send you.
Yeah, great.
Great.
Okay, any other
Just one-
privilege of the floor?
Yeah, just one for me. Special Olympics is coming up. So they're looking for volunteers. I think it's June 14th and 15th at Ithaca College. So you can check it out on their website. Just go to Special Olympics Ithaca.
Okay. Is that it for announcements, privilege of the floor? Okay, I think we can back up and do minutes now that we have a quorum, right? Yeah, we do have. So does anyone want to make a motion? Okay, Sheila was first and you're second. Any discussion or edits to add? I need Bible.
Actually, I like the way the minutes are structured, like the bullets. Nice and easy to read,
Oh, yeah.
at least the first page.
Okay, can we take a vote then? All in favor?
Aye.
Great. So the minutes are approved from the last meeting, which was in April. I jumped ahead about board correspondence or announcements, but I don't think there is any that I'm aware of. Frank, do you know of anything?
No, environmentally though, just real quick, we are excited to announce we were able to recruit a part-time psychiatrist to join the team.
Wonderful.
So Dr. Lisa Crystal Wang will be joining on the 29th of this month. She'll be working 17 and a half hours in the clinic serving clients. So she comes from a federally qualified health center in Chicago where she focused on population health. So she's done a lot of work on integrated health there for their clinic. She continues to consult with them, the other part of her time remotely, but we're excited to have more clinical time.
Yeah.
So that'll be starting at the end of the month.
Age range,
I'm sorry?
patient age range?
That's a good question. It's not gonna be super young children. It's probably typically, do you know the age range that Dr. Crystal Wayne sees?
I'm not sure about that.
Yeah, I wanna say,
12 and over.
yeah, probably looking at 12 and over.
I'd love an update, if it's not just 12 and over.
Yeah.
Well, that's good news.
It is good news.
Okay, so I think we're through the first part with mini lines and we're on to the Family and Children's Service of Ithaca update. Is that person
Yep.
up there?
So
Okay.
just by way of introduction, Elisa Sunsmo is the new clinical director at Family and Children's and is here to talk to us about their offerings and what they've got going on. And Alicia was in our community previously up at Cornell as well, so we're welcoming her back too. So Alicia, we'll turn it over to you.
Thanks, Frank. Nice to meet you all. I'm going to go ahead and share my screen. And I'm filling in for Alicia Canali today, who couldn't be with you, but hopefully I'll do justice of her presentation and overview of what the last year has been like for Family and Children's in 2023. I'm not sure how long it's been since Family and Children's has made an appearance here, but we wanted to make sure you kind of had a general view of where we've been in the last year and what we're excited about coming up. All right. Sharing screen going okay there in the in-person room?
It is. We can
Yeah.
see your screen.
Mhm.
Okay, great. All right. So 2023, I joined the team, just for context, in late September of 2023. And so looking back at that year, there was a consistently high demand for clinical services, as you might expect, ongoing staffing challenges, no surprise there. And I'll go into each of these areas separately. We had a few successful community events and some great new funding that came on board for some initiatives that will be moving forward. In terms of that consistent high demand for clinical services, as is most conversations about Family and Children's when it comes to the clinic, is the wait list. Many of you are familiar that there was a pause during that 2023 timed frame. So the demand for that average wait list across that year, so crept up until in 2023, there was actually a stoppage of that in the spring. And that stoppage of adding anybody new to that wait list outside of folks who are urgently in need of assistance then was lifted in November. So that 192 in the 2023 is likely falsely low compared to what the actual request for services would have been coming in had that stoppage not occurred. Just for a snapshot of where we are today, the current list is about at 170 when I checked it a few minutes ago before this meeting started, just to give you a snapshot, and about 100 of those are adults and about 70 of those are children under the age of 18. Focusing on that, we are experiencing a lot of the workforce challenges in a year with a lot of change in 2023. And prior to that, there was higher than average levels of turnover in our clinical team. And we've really been challenged to keep up with replacing those positions, having a hard time recruiting and retaining new and experienced staff. This level of challenge is not unique to just our clinical team. So I do want to highlight that we have also seen high levels of turnover on our outreach programs that affected our ability to really transition programs smoothly as we would like to, as that high level leadership had lost some momentum. And then we've also struggled overall to compete from a salary perspective as newer competitors have come into the market on a workforce standpoint, whether that be all of our healthcare startups that are recruiting folks to work by telehealth from home, to some of the ways that other folks were able to enhance their salaries during the pandemic. Family and Children's has not kept up with where that median is locally or nationally, and that has been a major barrier to recruitment for us. Thankfully, we did have some new additions to our team in these last little bit here. Obviously, I joined the team, but I'm also welcomed by very wonderful colleagues. Leon Holden joined us in February of this year as our Director of Equity, Inclusion, and Belonging, really focusing internally on staff as well as externally on how we meet the needs of our community. Michelle Thevenin joined the team just prior to my arrival as the Director of Development, I believe in August of last year. And Wade Carmichael joined the team as our Director of Youth and Outreach Services. So we are excited about some of the ways in which we can invest now from a more stable management team level in trying to build some better strategies, culture building, knowing that compensation itself is not the only piece of the puzzle when it comes to recruiting and retaining staff. But we will be focusing on those efforts even better now that we have some more solid management team members in place. Some of our successful events this year, hopefully many of you got a chance to participate in them. I know many of your agencies were represented there, whether it was our Better Together for mental health events, the Family and Children's Cardboard Boat Race, and then the Ithaca Cupcake Contest, where we were the recipients of that, including my own 2 young children, and I baked one of the winning cupcakes, which was super fun. These were great events to really build awareness across the community and not only in support of Family and Children's, but of all the organizations in the local community. Some other exciting pieces were some funding that we were able to receive in the last year. So the Patrick P. Lee Foundation gave us $150,000. And this grant has been wonderful in supporting our work. There's a big piece of this that is about this recruitment and retention of staff. So we're able to pay folks back for licensing fees throughout the pandemic. We're going to be investing in professional development training, particularly in areas that we have not kept up with as well, like our treatment of co-occurring substance use disorders, et cetera. So we'll be really investing now that I've had a chance to get to know the staff over these last few months, figure out where some of our gaps are. We'll be able to strategically invest that funding in some agency-wide trainings. And this funding has really been critical to be able to support us in doing that work, not only in paying for the trainings, but also the loss of revenue that will happen when we pull everybody out to do those trainings. The other major piece of this funding is going toward our first year fees, where we will finally be moving to a cloud-based EMR. We are so excited for this, and it is long overdue. It is not the sexiest of topics to talk about EMR. It's sort of the software everybody loves to hate. At the same time, it has been such a challenge to really effectively see our data, to make management decisions that are based in data when I can't pull any of that out of our existing EMR. So we have been really hamstrung in our ability to efficiently run our clinic and use data to inform our decision making. And so this move to a cloud-based EMR system, hopefully with a more modern EMR system that allows us to better use data to guide decision making, I'm really hopeful that that will help us see some new places where we can improve our service delivery, as well as help clients and staff receive some feedback about the good work that they're doing. So that's a super exciting move from my perspective. Some other work that's going on behind the scenes at Family and Children's that you won't likely see from the external side is we're really starting some strategic planning processes. So there was a work group that started on our values work. That was the first piece of this strategic planning that started just prior to my arrival. I know they're making a board presentation this month about the results of that value-based work and really coming up with some ways to help us guide decision making as an agency about how it aligns with our values, give us some clearer and transparent language we can use, and help assess our own ability to meet those values when we survey our clients and folks who use our services against what we say we value and what we're doing. We can do that better if we know what we're doing and what we're intending to do. So I'm really excited to have that as a benchmark for our values that then will help us guide the work forward. Once we finish this values work, then the other 2 major pieces that we're turning to are clinician recruitment and retention planning, as well as strategic work around equity, inclusion, and belonging. Other important pieces on our horizon, one of the critical pieces that I observed upon coming in, as well as our feedback from our OMH review, is that we need to do a better job and really re-examine our service delivery model, how we assess how we're delivering our services and have a goal of better meeting community need. It is clear that wait lists like this are not intended. And so we need to strategically think of doing something differently if we ever think that's going to go away. So that is a key piece of us really redesigning that clinical model to be able to better meet the need and bring down that wait list so that we can be more responsive to the community need. So that is some critical work that I've been putting a lot of thought into since my arrival and is fueled by our OMH review, where they really called that out as a key area for us that we need to improve. As I said, there's continued investment in our equity, inclusion, and belonging work, and we'll be continuing to think through where Family and Children's fits in the continued Medicaid redesign efforts. A couple other pieces I wanted to highlight from our outreach program. Are a few of those as a reminder for those who might be less familiar with our outreach programs. Our DAP program, Dispositional Alternatives Program, is a community-based, family-centered program providing comprehensive support services to youth ages 7 to 17 at risk of out-of-home placements and their families. So a variety of services there. Again, this is a non-clinical service, but focuses instead on the informal counseling, coaching, mentoring, socio-emotional skill building, etc. That this team really strives to support these children, the youth, I guess I should say, and their families. All free of charge. Referrals are made from DSS. And just as a kind of an overview of the service delivery, there was 28 families that were in this program in 2023 with a completion rate of 10 families who completed the services, and 9 successfully completed the plan that they created in the program. So of those who are able to reach completion, which is about a third, most of those are completing their plan. In addition, DAP offered 120 group activities in various community locations throughout 2023, hosting twice as many groups as in 2022. Some updates from our Open Doors program. For those of you who aren't familiar, this is the program who works with runaway youth, whether they're experiencing homelessness already, facing housing instability, etc., and provides various confidential trauma-informed support services, again, from a non-clinical perspective, really focusing on client safety and well-being. This includes everything from in-person to virtual and telephone consultations, a 24-hour warm line, and then just some basic assistance meeting ADLs, whether that be food, first aid, clothing, hygiene, etc. These services are also provided to families free of charge. And then finally, when it comes to outreach, which folks might not be as familiar with as outreach programs, one of the other pieces that I've been tasked with is reconceptualizing our 0 to 5 and our geriatric mental health programs. These really have been cornerstone programs for our clinical team, really encapsulating that our services here at Family and Children's really strive to meet the needs of folks across the lifespan. However, in recent years, the programs really have focused a little more inward on clients that were already connected to our clinic in some way, shape, or form. And so one of the things that I'm working on is to redirect these programs to be much more outward facing so that they're less focused on the clients that we already are seeing, folks that are already needing clinical treatment services from us, and focus on those ways where we can leverage the clinical background that we have and the expertise in these areas, but really going out into the community, providing consultations and other services. So I'm currently looking to hire someone to lead this program and reshape what these are. We will continue to provide our child and parent psychotherapy programs for our 0 to 5 age range. We'll continue to provide our geriatric mental health services within the clinic. So all of those programs that you've been expecting from us in terms of serving the clinical needs of all of those populations will continue. The piece that we're going to be hopefully adding is this design of what the funding for these specific programs to be more of an outreach program rather than more inward focusing for our clients at the clinic. So without further ado, I wanted to make sure to save a few minutes here at the end of the 20 minutes. So it looks like we've got about 5 minutes before the next agenda item to open the floor for questions.
Jessica has a question.
Thank you for the presentation. It's Jessica Connor from Northeast Peds. I know we've talked several times already about the real strengths and the big place that Family and Children's holds in our community, as it's looked at as really a pillar of children's mental health services, and the natural difficulties that leads to for you, such as your large wait list. You did note that salary is a difficult component. I mean, when I saw the program lead positions come out, I think the salary is $50,000, which in our area, people can easily get twice that salary for that type of experience. So I'm wondering, like, is this a situation where, like, do you think like a financial audit would be helpful in like seeing if there's like billing things that can be optimized, or is this a need for more multi-year grants? Because I know like Family and Children's, like when I look at the overall annual reports, it looks like a lot of the funding is really through grants. Financially, what do you think are realistic options to make the
Yeah.
salary ranges more realistic to be able to hire anyone?
Right. Yes. You sound like my presentation to the financial committee of our board. I think that there was a lot of misunderstanding of where the field has gone and what current pricing is. So one of the things I was able to do at a recent financial subcommittee meeting with the board was sort of give an outlay from what I know about this specific community, but also the national players and what has happened with telehealth competitors and what we're seeing. And there's a jaw-dropping difference, right? Obviously, between what we've been offering and what other folks are. And I think right now, we need to have a lot of conversations to redesign. The 2/3 of our funding actually comes from our billable services. So it's not mostly grant funded. However, figuring out how to get from here to what would be competitive is a big leap. There was some advances in our salaries that just occurred during the last year or two before my arrival. And there was they were even worse. I believe starting salary was 45,000 for a beginning therapist, and it is currently the child and family therapist posting we have right now is at 50. The program lead position is only a 30-hour position that was posted, so it's not a full-time position, which leads it to be a little bit lower, which is why it's a little higher annualized compared to our other positions. But you're right, it's totally out of whack for what we would need to get the kind of people we need to run these programs and really contribute. I don't know what to tell you in terms of a solution other than that it is known by our executive director, it is known by our board, and that is a piece that we need to redesign. And I honestly think there is multiple pieces to that redesign. It's not as simple as go out and get a multi-year grant. I think it is about rethinking our overall clinical model and what we do that would hopefully address both the waitlist and the salaries for clinicians. Some of which was flagged by OMH is that we also have some of the lowest caseloads of peers. And in part that allows for clinicians to have better balance in their lives and how many clients they're seeing. And at the same time, it means that we financially don't make as much as other agencies who can then afford to pay the clinicians and give that back to them. So there is this balancing act where we need to really think through where we're going to be so that we can be more sustainable financially, continue to attend to the important quality of care issues while also I think aligning everything in the same direction with regard to serving the community as well. So I don't have more I can offer at this time with regard to those specific solutions, but please do know it's on our minds very much so.
Great, thank you. And just briefly, do we have any numbers on Open Doors, number of individuals served? I love the Open Doors program.
Yeah, I don't, unfortunately. This is what I was given by Alicia. Unfortunately, I don't have access to more of the data for that program.
Okay, thank you.
Yeah.
Any other questions?
Well, I had a question that really maybe more for Frank or Harmony, but I was just wondering, is there a sense at this time about what the overall unmet need for access to outpatient care for adults and children is across providers in the county? And is there any current strategic planning system-wide about how to address that? Because I mean, the issue that that she's presenting is not being faced, I think, only by Family and Children Services.
Yeah.
Right. So I was just wondering sort of what the status of the thinking or planning about that is as a system of care at this point.
Talk about the mapping. Okay. The short answer is probably not as sophisticated as we would hope. There's been some sequential intercept mapping that's occurred in the community to kind of look at different pockets of areas that need additional attention. Quite honestly, we're all drowning at the moment and trying to figure out how we tread water to get to a place where we can be more strategic about it. The similar, our salary issue, we've made a little bit of inroads to be able to recruit. We've made some changes to our processes to be able to recruit. But as far as where the gaps are, I think we're hoping that, some of what Dr. Connors work around the children is going to help us have a bit more understanding there. We know that the school districts need more in their locations. We certainly know that the wait, while we have a different model where we take people in as quickly as we can through a walk-in process, then it takes a little bit longer before they get to see regular therapists. So there's still a wait for service there. I don't think we've all sat down together and kind of mapped out, kind of what you're describing from that perspective. Alicia,
I did some preliminary data. I was trying to pull this together for Alicia a little bit, just similar modeling to what I used to do with in the college student population, which is my sort of area of expertise that I'm dabbling in some new areas, but I have 15 to 20 years of leadership on that end where we're really thinking about a population health approach and sort of trying to figure out what's the unmet need. So I was trying to use some similar data, pulling from what do we know about incident rates of mental illness? What do we know about the Tompkins County population? What do we know about who's serving whom? And trying to map some of that out, particularly with regard to how we're serving our Medicaid, since we're the two organizations that predominantly are serving that population, right? Where we've got all these other agencies, national telehealth agencies and others who are picking off the folks who have other types of either private insurance or can private pay. We're increasingly seeing that burden for all of those clients who have no other options other than us. And so trying to really map that out, I was able to pull together some numbers, but I would love to be part of a strategic effort. I think we're still gonna, whether we find that number or not though, there are not enough clinicians willing to work in this area to do the work that we could even hire them at rates we could pay them. I just don't see the numbers of people, whether it was I was at Cornell, a national health startup, right, at Mantra Health, or any of this, what I'm seeing in this world here, regardless of salaries, it is really hard to recruit mental health professionals right now. And I think that we need to pay attention to that and invest in how we're recruiting the folks from the bottom up before we'll ever start to come close to meeting the needs.
One thing we're thinking about from the Collaborative Solutions Network side of things, which again is like our youth focused mental health collaborative across the county, is thinking about step-based care. Okay,
Yeah.
So rather than like sending everyone with a mental health need to Family and Children to see someone who has a caseload of 30 people, if people have lower level needs, can we get them started like with me? So at the pediatrician's office, I see about 800 kids a year. And so at a much lower intensity than they're able to see folks at Family and Children. So how can we, between thinking about using our system as a collective and being able to more efficiently step people up to higher levels of care when they need it and step people down to lower levels of care when they're better supported, and thinking about how to work collaboratively with not duplicating care, but trying to get the right amount of care to the right person. So who needs a school social worker checking in on them once a week versus who needs a trauma therapist to do intensive work versus who needs help connecting with a local food bank. And I think that's really our best foot forward is thinking about a bigger stepped care model. It'd be great if we had magical data around things. We are going to be trying to collect more qualitative data this summer. And if you have anything from your work in previous locations about collecting data around these kinds of things, I think there's a lot of community interest and community goodwill in terms of all working together.
Yeah, 100%. Stepped care is what I've helped to build at the last two universities I've been at. I'm very much a fan and would love to be on board and seeing that brought to our community.
Nice. Okay. Hi, I'm Anna. I'm a clinical psychologist. I work with kids. So just as an observer, I'm still new to the community. I have noticed that neither Ithaca College nor Cornell has any clinical programs, clinical training programs for mental health practitioners.
Yep.
And this sort of struck me as quite unusual in a town like this. As Ithaca College in particular is set up, I feel like perfectly to begin a program. I don't know if anyone's ever spoken about this before, but they already have the PT and the OT programs. So it's almost like it would be a natural fit to start a MSW program, for example. I don't know. So, and of course, Cornell, does not have a clinical side for their psychology program. So I've had, several patients of mine who have been working with therapists with you, but then suddenly have had to stop because because of this turnover situation that you've described. And I know that it's just so pervasive anyway. So this was just something that I would love to be able to brainstorm with people if there's any way to present these ideas to the colleges, simply because the need is also not just, in the community, but it's also at the colleges. And this would be such a tremendous resource for everyone. So,
Those conversations are happening.
oh,
Um,
wonderful.
I wouldn't say that we're ready to open doors yet.
Right, no, of
But the
course.
conversations are definitely happening. The chair of the Board of Health is actually the new Dean of Health and Human Sciences at Ithaca College. And so we've had these conversations about expanding, the different types of degree programming that they might be able to provide. Very early steps, right? Early conversations. Cornell is a bigger nut to crack. There's just so many different entry points into the different colleges and things there. But we've been talking with the folks. I've been talking with the folks that we're connected with up there, both in the Brooks Policy School as well as the public health folks, to help them understand that mental health is, if not the top, one of the top public health issues facing us right now. And they're missing an opportunity
Totally.
to help fix that. So we're having some conversations. I don't think we're there. I think we probably have a better path with Ithaca College, just as you described, because of the way they're set up and the connection to their leadership there. But we're working it. We're working every angle we can.
There's also like goodwill and good intention toward increasing our county's overall profile to other to be a training site. So Family and Children's, Tompkins County Mental Health, Mindwell Center, and I have all talked about seeing if there are ways that we can more robustly try and recruit people from, like, trainees, specifically from Binghamton, right, who has a big, has both the MSW and the psychology program, looking up in Syracuse, looking up in Rochester. So I think the coordination of that has been more of a bandwidth concern, but there certainly is goodwill in terms of trying to make Tompkins County a more attractive, robust place to pull in trainees with the hopes of then retaining.
The second point that I wanted to make is I so appreciate that you offer the in-person work, especially for children and families. It's just, to me, this is an area of huge concern that there have been so many, the shift to virtual for many reasons. I feel it is just not optimal or that effective for children and families. And so having that opportunity with you is so important. So thank you. And I hope that that will, continue in your plans as you as you consider how you're going to deliver your service models.
Absolutely. And it's definitely an area of focus where we're getting more people trained in CPP and others, folks who aren't coming in with that child background, but who are open to it. One of the things we're trying to rethink is, like, how do we provide that training on the job to help people sort of stretch the lifespan or the ages within that lifespan that they're willing to treat, and how do we develop those modules along the way to help them and support them in that. And we have some unique opportunities to do that. So we've got 4 folks in our CPP training right now to really learn that model of care.
We have time for one more quick question, but we're running a little over, but you had a question, it looked like, or a comment.
A question, a comment. I think this is the most important issue of our time, mental health. I don't think there's one that's higher than this, could affect everything. In speaking to people in schools, you're right, there are layers of assistance that are needed. And that one of the school therapists who'd been there 20 years said never seen anything like this. 20 years in their mind. But they said, we know who needs help. We know what layers of help they need. They know they're dealing with these kids on their front lines. All the school people know exactly what kids need the most intense help and what kids need to build drones after to build those things. So I think it's the most important issue of the time. I'm really glad to hear that people are interested in this. But one of the things that I learned in business is that you can't worry about the money. So as soon as you start worrying about the money, we can't do that because it costs that much money. We can't do that because it costs that much money. And I hear that even with the legislature, I hear it all the time. We don't have any money, right? Which is not true, by the way. Our reserves grew $10 million in 2023. And then we already increased our reserves. So, and we're going to increase our reserves another 5 million this year. So the county has money. It's your money, right? And I'm really surprised that people don't see it, but more people are on the legislature. They're seeing it. So I think that, this group and the people out here that are looking to solve this problem, you may have to throw money at it. I'm sorry, maybe if you really want to make an impact, you got to throw money at the right things. You have to justify it to the legislature. But I'll fight for the money if you tell me this is the right thing to do. So I just want to share that.
Very interesting discussion that it sounds like we could continue at another time, but I don't want to take time away from our other topics. So any last comments or questions other than thank you so much for your information and also for getting a good discussion started.
Yeah, absolutely. And just want to offer, if any of these discussions you want to include me in, I'm happy to rejoin for any other, whether it's about training, a joint pre-doctoral internship. Jess, I don't know if you've ever thought about that one, but happy to
think about it sometimes.
Yeah.
Yeah.
Happy to be part of the solution here from Family and Children's as well. So thank you all for inviting us today.
Yeah, thanks for
Felicia.
coming and have a good evening. You're welcome to stay, but
All right.
probably want to get home.
Yeah, thank you. Bye.
Okay, bye-bye. So next on the agenda is the encampment enforcement discussion. And that is Frank, who's going to start us off on that.
Yeah, you'll have to excuse me. I don't remember. I've talked about this so much. I don't remember who I've told how much to. So just by way of background, in the second half of last year, as summer was coming to an end, the situation in the encampments had grown, I think, to a more significant level of unsanitary condition than we've seen in a long time. The encampments have been there for a very, very long time, and there's been a lot of efforts to try to address them, but the sheer amount of waste and environmental damage that was being done really got to a tipping point. And we at the health department in our environmental health division have responsibility for ensuring sanitary conditions throughout the county. That's kind of a blanket statement. Over the years, we've taken a bit of a hands-off approach with the encampments because there's been a lot of energy and conversation around what do we do out there. And we're an enforcement tool in this setting, right? And enforcement tools are not fine-tuned. They're not often designed to prioritize the human side of things first, right? It's this thing is wrong, you have to fix it, we don't care how, fix it kind of thing. And that's not really the approach we take in environmental health to begin with. We very much try to be an educational kind of organization. Again, we were trying to defer to the other efforts that were underway to try to address the encampments. Towards the end of the summer, between the community concern, the complaints we were receiving, quite honestly, the legal, the lawlessness component of what was going on out there, and the environmental contamination, including the waterways, really got to a place where, you know, we couldn't wait anymore. It was time that we needed to take some steps. I do want to say that the city of Ithaca has been a good partner in this, and I think they are attempting to address the issue. What we were able to provide, I think, was kind of that last push, right? That, okay, we've gone out there, our environmental health staff went out, looked at the situation, documented the issues around the complaints that we received, and ultimately issued a notice of violation to the city of Ithaca and the railroads for the encampment that's located between Tabor Street and the railroads. We focused on that area because it was the worst from an environmental contamination perspective and a sanitary perspective. I will say that our enforcement effort makes no judgment on whether people should be able to live on the land or not. That's not our concern or issue. Our concern is that whatever is allowed is done in a sanitary manner. So it really is up to the landowner to decide what approach they want to take to maintain that sanitary condition. The city has a proposal that has areas that people shouldn't be in and an area where they may be allowed to be in. Our hope is that they will kind of work that process out and get the other areas cleaned up that need to be cleaned up before we have to necessarily go to a next step on enforcement to other parts. The railroads in the city have already begun cleaning up that section. If you haven't seen it, some trees are already down. They are cleaning up the mess that is out there. And as I understand it, there is nobody currently living in that particular encampment. Not solved homelessness. So those folks still are out there, and some of them have moved to some of the other encampments. And I think that's really where the long-term plan from both the city about what they're going to do related to camping on their land and what the county is looking into doing around year-round low barrier sheltering will have to come into play, because part of the challenge is you can't remove people from public lands if you don't have a place for them to go. And right now, outside of Code Blue, we don't have that option. So I think there's a lot of good work that's going on. I think the legislature is committed to finding solutions around this. And I think the city under Deb Mullenhoff's leadership as their new city manager is really making efforts to try to address the situation out there. But by way of enforcement, right now it is contained to that area between Tabor Street and the railroad tracks, and it is currently under a cleanup effort as we speak. So I think it's already shown dividends. I'm not taking credit for that. Our department isn't taking credit for it. I think our notice of violation was just another tool in the toolbox to kind of help the decision makers understand that some steps needed to be taken, and they've begun to take those steps. So that's where we are right now. The city has submitted a plan for our review, but they've already started implementing that plan. We're in the process of providing them feedback on that plan, which was good and we support. We're hopeful that this will continue in a positive direction now that, I think we have all the right people talking and looking at the appropriate resources to perhaps really get our arms around the encampment situation. So that's where we are, and I'm happy to answer any questions.
Questions or comments, Larry?
So, this is where I I hadn't anticipated not a conflict, but a tension between the different roles across across whole health, um, because I feel like the reason I bring the issues up, and I know you probably carry this message and agree with this message. If we're moving people or encouraging people to move, because I don't know how people left the area that is of most concern. I don't know how many people were there to begin with and how easy. I'm just concerned that as we make these decisions, people are treated as humanely as possible, and also that their rights are respected. I would be interested in having a conversation with the Community Services Board, having a conversation with, and maybe it's a combined Board of Health and Community Services Board, having a conversation with the city and the county as plans move forward, so that those of us who aren't necessarily doing the day-to-day work but have a role in terms of the overall health and safety of people, particularly people with disabilities, we can have input or at least be knowledgeable about what's happening. Because, the reality is most of the people who live in the encampment or are at risk for living outdoors are people with disabilities, both probably easily clinically documented and also just by social construct. So I just want us, as we're moving forward with the changes to the encampment, that we, meaning the Community Services Board and the Board of Health, are really consulted.
Yes, Randy.
Now, it's called the continuum of care. Is that the policy? Is the city and the county meeting together to discuss kind of how the continuum of care would work with homelessness? Or I think I read something about that. I'm not.
So
I must have missed something.
there's some language in there. The Continuum of Care is also an organization that focuses through the Human Services Coalition on homelessness. So they're the ones that put out the plan for what we needed to do kind of holistically about homelessness. As far as what's happening with the very specific encampments, right now, much of that is centered with the city and them working with community partners, which includes the Continuum of Care and outreach workers and such. The plan has been publicly debated. It is out there for review. I don't think anyone thinks it's perfect, but I also think the conversations that the legislature is having about low barrier sheltering is also a big component of what will ultimately make that city plan successful or not. To Larry's point, I think there is a lot of input that's happening into this process. If the board wants to talk about what other ways they want to be involved, we're certainly open to that. But I will tell you, this department, nor really the county for that matter, is running the process around what's happening with the encampments. It's a city-led process because it's primarily on their land moving forward. I will say that we have been humane, and to Larry's point, the Board of Health, some of their first questions when we brought this up to them was about the people, right? What is this going to mean for the people out there? What are the unintended consequences? How are we doing this humanely? So I think the Board of Health is on the same page, Larry, as you all and the board about making sure the human beings are put first, which is why I kind of prefaced that this enforcement tool isn't necessarily the best way to go about doing this, but unfortunately, nothing else had really moved the needle on it. So it was something that we had to use as a mechanism. But I'm hopeful that it has kind of spurred things to where this first very relatively small location. And to answer your question, Larry, my understanding is that there were outreach workers, as well as some, I believe an IPD officer that had created some relationships with some of the folks in the encampment that had been talking to them about what was going to be happening in that space. And there was, I want to say there was only a couple of people that were out there. And before our notice of violation was even issued, that encampment was emptied. So our notice of violation wasn't the driving force on folks being, leaving that space. It's a complex issue. I think everyone knows and gets that. And Larry's points are extremely well taken. And I think there's a lot of the outreach workers have voiced those same concerns as well. And we all want to find, the best solutions. What I would also offer, though, that letting folks live in the conditions that existed in that
Absolutely.
encampment was not humane either. So,
Absolutely. No, I totally-
yeah. So I'm with you, Larry, and I we'll take all the help we can get on trying to figure out how we do this the best way possible.
So can we invite, when it's convenient for her, can we invite Deb Molinoff to come and address us? Just to give us a sense of what the plan is going forward.
I'm sure we can ask. Yep.
Perhaps Rob Cantelmo too, the mayor. I think the council and the mayor have to be involved just in some way because it's their responsibility too. So I think it's good to have someone representing that group other than, what's her name? Deb.
Deb.
Deb Molinoff.
One of the questions I have is like, does that, by closing off one area, does that just mean that the next area is going to get contaminated all the faster because there's more people there or there's less space to.
Yeah, that is the concern, right? And I think part of what we're asking from the city is what is the plan to not let this come back in this place or get worse someplace else? I think the short answer is we don't have the answer yet because we don't have a low barrier shelter year round. The wintertime Code Blue exists, right? So that's essentially the low barrier option. But once the weather gets warmer, two things happen. Code Blue goes away and the interest in living outdoors grows because it's not as harsh, right? And we those that have been around see this every year. The numbers go up in the summertime. And then as it gets colder, they go down and people retreat to either Code Blue or even before Code Blue, the numbers would go down and they would go to couch surfing or would be finding other places to shelter. Right? Because everyone got worked up in the summer because the numbers grew so big and all the impacts that went with it. And we'd start talking about it in earnest and then winter would come. And the problems would start to subside and people's priorities would shift to other places. So not only has the population ebbed and flowed with the weather, so has the attention and intensity of response ebbed and flowed with the weather because of the impact that it was having. I think what we've seen in the last couple of years is it's been steady. And it's gotten significantly worse from total numbers. And so that impact has been worse. But I'm sorry, I said a lot, but to circle back to your question, yes, part of it is we're just displacing people to another area. The idea here is we're hoping that in that displacement, we're also having conversations with those folks about other options that aren't living outdoors that might be available to them. It's another interaction with an outreach worker and others that are communicating with those folks. But we're hoping that this is a snowball of we're starting to build a longer term solution that there will be a place for people to go, not just to another place outdoors.
Whatever solution we do have, the city's got to be included, right? Because that's where most of the helps are. What the county is doing, the legislature is strongly considering funding or building a homeless shelter. There is state funding, federal funding. The county's put $1 million aside in reserve for this homeless shelter. They've got to find a place for it, and that's where they are today, trying to figure out where that could happen. And I think that wherever it is, the city input should be very important, right? Because of where this homeless shelter is going to be. You want to be close to services and those kinds of things. But I think the legislature we need to be leaders, and we need to give Frank and the city good direction and vision on what needs to happen. And it could be single living units like second wind cottages or whatever it is. And I think the legislature generally thinks that's not a bad idea. So whether we can work with the city to formulate a plan remains to be seen.
Other comments or questions?
Well, I was just wondering, there have been a number of new supportive housing beds that have come online in the last couple of years. Do we know what impact they have had on the unsheltered population and on the encampments? I mean, one would presume they are targeting, some of the greatest need individuals. So do we have a sense that that is affecting the demand or the use of unsheltered settings? And if it's not affecting them, we have a sense about why that is, why there'd be a mismatch between more supportive housing beds, which is generally understood to be the solution to homelessness, right, including unsheltered homelessness, and the continued growth in the unsheltered population.
I would say that we're getting more housing, but it's not yet. I think we're just going to be seeing that in the next couple of years. There is going to be a housing surge right over here in these apartments. We've been doing a lot of work with the COC on making sure people have their disability paperwork that's required for them to get in some of the housing over there. So they're having a housing surge. I believe it's going to be in mid-May or late May. It's coming along pretty soon. And that's going to be, I think it's 50 units. So, but a lot of those projects are still in the built stage. So we're not getting that relief yet from them. There are a lot of other programs that are online for the Office of Mental Health that are specialty housing solutions that incorporate intensive case management with them. And those RFPs, those requests for proposals have gone out by the state. In large part, there's still some that are coming out, but Office of Mental Health got a lot of money from the state this last year to do some of these things, but prior to that, they hadn't been building any new housing for many years. So there's this huge need, and they're just getting the dollars out to people. They're slow in getting some of their contracts written because they've had this massive surge of money, but not necessarily all the back office support they probably need to get all those contracts written to get the money flowing. So I would say we'll see a difference in the next couple of years. It's going to take more time.
The number of people being defined as homeless or houseless has grown in the last few years too. So, coupled with anything that we've built, the number has just gone up. And county has a whole nother department of social services that is, kind of the housing / support folks. And so we don't have our fingers in that as much as they might from that perspective. But as Randy said, I'm glad he said it, because that is really what we need. We need our elected leaders to give us the vision on what they want to have happen, and then we'll go try to make it happen. And I'm hopeful that that's what this enforcement tool kind of did. It was a bit of a nudge to say, okay, this is gotten, here's the pictures, this is bad, we need to do something. Everyone knew it was bad, but I think putting it to the top of the list is this is what we need to work on right now is part of what happened, because
Okay, we're running out of a little bit of time, so just if people can keep their comments as short as possible. Yes, Stu?
I'm just looking for some numbers. You said 50 new units will be available this month at the end of.
I think it's the end of the month.
And you said the numbers keep going up and up. Approximate number where it was. What percentage will this might fill what are we at, 300 people homeless?
Yeah, I think we'd have to talk to the continuum of care folks to get a better understanding of, where that's at. There's been a couple hundred people housed through Code Blue throughout the whole winter, so even if 50 of them, that's a quarter. Right, of that, just rough math in the back of an envelope kind of stuff. Again, there are other groups that are, they're the owners of the data and the numbers on those housing things. And, we're just wanting to be there to support them, with the additional services that people might need.
Thanks.
One thing I wanted to just find out from people is if they had an interest in having either the person or some representative from the housing company that is going to get the grant for, because no one else applied, you know what I'm talking about?
House one?
Yeah, it's, what's the name of the housing place, the one that's got it's got Art House and the other one, right?
Casino is casino, is that or is it
I forgot the name.
At any rate, there was an RFP out and no one responded except this housing. And people have probably seen it in the Ithaca Voice. My concern is, nobody else did it, so I guess it's okay that somebody's offering. But I'd like to know what kind of training they have, because they say they're gonna help people to continue to function so they can keep their housing, and concrete skills are fine, but also it seems like they'd have to have some understanding of, mental health and some other issues that impact people who are homeless. So do people agree that they'd like to have someone come and talk about that a little bit, or talk about this plan, what their plan is to help people?
Yes, please.
Yeah, sure.
Okay.
Yeah.
I don't want to take up too much time because we've left Harmony with very little time to talk about the services plan.
That's really okay, Jan, because it's really just to give you a heads up. So as you know, last year, or most of you know, last year, we did a local services plan. It was the first time they moved to a 5-year from doing the plan every single year. But they do want us to review the plan that we wrote last year and make any modifications. So I reached out to Jan. I have a rough draft document that Jan and the chairs of the subcommittees will use to review. Sometime in the next 2 weeks, we'll have a meeting and plan on that, and then bring it back the full, any revisions to the plan. I can tell you we're on task, that we're on, it looks like we're going to achieve most of our goals that we established for this year. There's a few that it looks like we have to break them up into smaller goals, I think, or objectives. We thought the objective fit, and it really probably needs to be broken into some more steps. And it looks like we thought we could save the world in 2025. So we may need to put some of those, objectives into another year. But overall, I think there's some pretty modest changes that we'll make as a group. Our goal areas are workforce, housing, crisis services, and cross-system services, non-clinical supports. We really focused a lot on peers, recognizing the opioid epidemic and some things we could do around that one. That one's around adverse childhood experiences and transition age services. So next month, before you come to the meeting, you're going to get a report that's just going to have all of those goals and objectives in it. It's not going to have all the detail like in the local services plan that you can find on the website. It's just going to have the goals and the objectives and any changes that we've made for you to vote on next time. So that's coming. A couple other quick things I did want to let you know about. We're over. We have 2 new children's programs that were just awarded by the Office of Mental Health. They're home-based crisis intervention. So last time I announced the ACT team for children, home-based crisis intervention, unlike ACT, which is like you get an entire team wrapped around you and you have that for about 9 to 12 months. A home-based crisis intervention, you still you still get to keep all your providers in the community. It's just more intensive support for about a month to 3 months that they come in and really give the family a lot of support. So it could be a really good program for children in crisis.
and you're trying to prevent them from going in residential services if they're in and out of the emergency room. They really don't need to be hospitalized. It's that kind of program. So Children's Home of Wyoming Conference out of Broome County was awarded the one home-based crisis intervention program, and Racker was awarded a second one that's going to be specifically for children with developmental disabilities. So it's really nice to see our community is going to get two. What I told you about OMH doing a lot of RFP awards and contracts are coming slowly. So it's probably going to be, I would say, 6 to 8 months before we see them happening, but it's good to know they're happening. Also, the RFP that was the LG opioid dollars for the emergency housing and intensive case management support was awarded to Catholic Charities. We are in the process of finalizing that contract, and unlike the state, we move a little bit faster. So we're hoping to have that program beginning at least in mid-May. And once they get their feet under them, they can come and present back to you so you can see all that work that went into that whole design, and our partnership with the city has paid off, that we will have a program in place. Catholic and Charities has a program called The Place to Stay right now. It's a women's program, 3 beds. They're going to be expanding that. We talked to OMH to make sure it was okay. They're going to have it's going to be a program that can support 10 people who have intensive needs. It will be a low barrier kind of a program to get into, but with a lot of support to help people identify what their goals are, what their needs are, where they want to go. And I'll have different levels of support where some could there'll be like 3 rooms in a house, male and female, separate houses. And then they'll have some that will be in apartments. And that apartment, if you're in that apartment and it's your single apartment and you want to stay there when you're done with the program, then you get to just transition right into that apartment once you're ready to go. And that's going to be a 9 to 12 month program. We're hoping for most people, but no, some people might need a little bit longer. So that's some good news that we do have some things coming in our future.
Couple of questions, for all wonderful things. For the HBCIs, I'm assuming it's the pathway to referrals is through SPOA.
Yes.
And do you know so this is OMH programming. So the Racker folks are focused on dual OMH, OPWDD.
They had a
kinds of
separate
folks?
one that was for kids that are deaf. It's interesting what OMH is doing right now, because they just did that adult housing program we talked about before, which was for people with developmental disabilities, substance use, and mental illness. So you did not have so they are sort of broadening their scope. I think it's an OMH licensed service with an emphasis on developmental disabilities, which means you don't have to be an OPWDD to get those services. I'm hoping. I need to find that out.
Okay.
You made me think of that, like if it's OMH, then you don't need to be an OPWDD. That's a key to get into OPWDD.
And I'm assuming it's too early for there to be any specific contact person at Racker for.
No, way too early.
Okay.
It's been announced.
Okay.
I have a question or a comment. I think all this is great, but I also hope that Catholic Charities will make a point of having accessible housing, because a place to stay has never been accessible. And there are people with physical disabilities that are homeless and need help. So
that's why the model's nice, because they're going to have some apartments that are rented and things like that. So I'll make sure to bring that up with them.
yeah, great. Thank you. Anybody else have anything?
Any updates on Alcohol and Drug Council?
Oh, yeah.
Yes. The RFP, the 3 RFPs have gone today to Oasis for their review. Harmony and Ross, our public health fellow, crafted those. So once we get OMH's blessing on them, then they will go out. It's a 30-day posting for the RFPs, and obviously then we have to review applications, but we're actively in the process on that front. And we're still in regular communication with the board of ADC, which is all that's left. And Oasis, as far as their wrap up and close down processes as well. it's not great from that perspective. There's a lot of stuff still hanging out there about the building and records and those kinds of things that have to get worked out. But as far as moving forward, we're getting close to having the RFP launched publicly for people to respond to.
Larry?
Frank, can you just remind me what the 3 RFPs are?
Sure. Prevention programs was about 180,000. Outpatient was about 180,000. And then for the detox stabilization, there's the building and 600,000 of operational services,
Okay.
operational funding.
Do we have a sense yet of have decisions been made if we're gonna look for one provider for all 3, or are we thinking, is there any thinking about how we want those monies to be distributed?
So there will be 3 separate RFPs because it's 3 different funding sources.
Right.
But they will all be launched at the same time. And certainly anyone can apply for all 3 or anyone individually as they see fit. And then we will be responsible for reviewing all of the responses and seeing what's the best fit for our county.
And do you think there'll be interest in all the RFPs, or are we worried about that?
I'm cautiously optimistic. I think the detox facility with a turnkey building that's paid off and state funding going along with it will be, I think will be enticing to folks. And I'm hopeful that they'll be looking at the totality of what we have to offer and hopefully propose a plan that can meet all 3 needs.
Cool. And just finally, who's ultimately responsible for making sure that the patient records are secure?
Well, right now it's still the Alcohol and Drug Council because they exist as an organization. But I can tell you, there are records on the 5th floor of this building, which have been secured. You can't get on the 5th floor right now without a fob. And then there are additional records in the building up on Trip Hammer as well that is still secured. So from that perspective, the physical security of the records are as best as they can be at the moment.
Okay. Great, thanks.
I'm sorry, did you happen to say when approximate timeline when the RFPs would go out?
They're with Oasis now, so we need them to come back from them. I don't know how long that will take. And then they do still have to go through the county process, which they tell us can take up to 2 weeks, but I would imagine would go quicker on this particular issue. So let's say within the next 30 days, I hope for them to be live.
Stu?
Piggybacking on khaki one step further, it was concerned when the council stopped, a lot of the employees would be taken in by cars, and mention of the clients having the same opportunity. Do we know what has happened to the majority of the caseload, the outpatient people?
Yeah, so there's been an accounting for every client that they had. Many of which were referred to other services. Some were lost to care because they didn't want to continue. And others were unreachable. But there were multiple attempts, both by phone and in writing, to reach everyone. But Oasis has an accounting of every client that was in ADC's care and is satisfied with the efforts that were made.
That's good to hear from a community standpoint. I get that question a lot.
I don't want to say that means it was a positive, right? I mean, there were folks lost to care, no doubt, in that it was just a bad situation. But as far as their due diligence and trying to do everything possible to get people connected, they made very good efforts to try to do that.
Any other questions or comments? Got 5 minutes. All right. Is that it? Did you have anything further, Harmony?
No, I was just thinking you did a great job.
Wow, I can't believe we finished early, 5 minutes early. Okay, do I have a motion to adjourn?
So moved.
Hey, we are adjourned. Thanks, everybody. So we're.